Hello and welcome. I am Dr. Teri Schreiner. I am a physician at the Rocky Mountain MS Center, and I am happy to be here today to discuss strategies for improving brain health. So first, I'd like to start with just an acknowledgement of my disclosures. I do receive funding from multiple sources for the work that I do. But pertinent to our discussion today, I think the most important disclosure is that I am not a nutritionist or an exercise specialist. So although we will be discussing nutrition and exercise, I will be discussing them from the perspective of an MS neurologist, and I would encourage you to seek the expertise of a nutritionist or exercise specialist for anything more specific to your circumstance. And now I'd like for you to join me in an analogy. This is a picture of a castle, a medieval castle in England. And I would like to draw the analogy that your brain should be preserved and defended as a medieval castle may have been back in medieval times. We need to have all of your walls intact to protect against invaders. We need it to be functioning at its prime. And when we have stopped any attack of the walls of the castle, we need to fortify it and really make it stronger. Now, this is maybe a new analogy, but it's not a new concept. And I'd like to share with you a slide from my colleague and mentor, Dr. Vollmer, that has been presented in educational sessions similar to today's in the past, where he identifies the concept of neurologic reserve. Neurologic reserve is the capability and capacity of your brain to withstand and to compensate from attacks, so to speak, from anything that may be jeopardizing its function. Neurologic reserve is strongest when we are young, and it is the reason that oftentimes multiple sclerosis is not diagnosed promptly, because we have a robust reserve in which to compensate for any attacks. The reason neurologic reserve matters is because it helps us to preserve our function, cognitive function, motor function, sensory function. Our neurologic reserve is what allows us to continue doing everything that we want to do, even when there is the threat of something that would jeopardize that. In MS, when subclinical disease activity, when the disease burden passes a certain point and neurologic reserve can no longer compensate for that, then we begin to see symptoms in all of these different areas. Now, the good news is that MS patients can increase their neurologic reserve, their capacity to withstand injury, by living an active and healthy lifestyle. And that is what we'll discuss further momentarily. But before we do, I'd like to share another image that you may have seen before, again, courtesy of Dr. Vollmer, that illustrates many things happening during the course of someone's life with multiple sclerosis. What I'll draw your attention to primarily is this over here on the left side is a brain. And this is a young brain. It has a robust volume, a high reserve, and it's functioning well. Over time, even without multiple sclerosis, all of our brains atrophy to some degree. And that is important because brain size, or rather volume, correlates with function. And what we notice, again, if we go back to the left side of the screen and look at this brain, is that with the attacks that come with multiple sclerosis and the lesions that accrue, the atrophy is more severe than a brain without multiple sclerosis. And this delta, this difference here, is again what we are seeking to minimize with these strategies for brain health. Now back to our analogy. So I have painted the picture that this castle is your brain, and we want to defend it. We are going to defend the integrity of your brain, and thankfully we can through various different techniques, and we'll talk about those in a second. But just to add some, levity and some pictorial representation here on the left side of your screen, we see our Lego MS army. These are the invaders. This is what is going to be attacking the walls of your castle, your brain, jeopardizing its integrity. But we also have another army here too, and that is the army that is aging. It is the concussions that you get in a lifetime, the illnesses, both chronic and acute, that you fight, that all take can take a toll on the integrity and function of your brain. So now let's get down to the specifics. So what are the strategies for brain health? So again, going with my analogy, the first thing we need to do is stop the attack. You can't repair your walls. You can't function appropriately if you are fighting off an invader. And so the first thing that I will mention is this is not a talk about disease-modifying therapies, but one of the most important parts of treating of stopping the attack, protecting your castle, is actually stopping the disease, or to the extent that we can, calming down the attack with disease modifying therapies. And so if you are a patient with multiple sclerosis who has inflammatory disease, it's really important to be on a disease modifying therapy, or at least have this discussion with your doctor. The other things that we'll talk about in this session include more lifestyle factors. And so we're going to optimize your lifestyle to stop the attack. We're going to treat any other conditions that might be jeopardizing your brain or your body. And then lastly, but not insignificantly, we're going to fortify your castle with diet and exercise. So stopping the attack. So the first thing I've mentioned is disease modifying therapies. So your to-do item then is, if you are not on a disease modifying therapy, to have that discussion with your doctor to find out whether or not that is an appropriate strategy for you to stop the attack. Number two is to stop excessive alcohol intake. Now, there is evidence that in multiple sclerosis, as well as in other chronic illnesses, some moderate intake, mild to moderate intake of alcohol can have beneficial consequences. But we know that excessive alcohol intake does not just from a decision-making standpoint, but it is not good for your body, specifically your liver, and it is toxic in high levels to your brain as well. So stopping excessive alcohol intake is an important strategy in stopping the attack on your brain. Likewise, stopping smoking. So we know that your lungs have a critical role to play in activating your immune system. And we know that smoking irritates the lining of the lungs, and that has direct implications on how your immune system is functioning. For example, we know that T cells, one cell within our immune system, can cross the blood-brain barrier more easily in smokers. We know that disease-modifying therapy may work differently in people who smoke. We know that among children, developing MS is more likely if you grow up in a home with smoke. And similarly, we know that once you have MS, at least in the mouse model, the disease process is worse if you have been exposed to smoke. And so for all of these reasons, it's really best to stop smoking. And I know I'm saying that and it sounds so easy, though for smokers, it is not. I'm not minimizing that, but it is a critical step that you can take to stopping the attack on your brain and maximizing your brain health. Other things to do to stop the attack. So we want to treat all chronic conditions. So that means diabetes. We want control of your blood sugar. For hypertension, we want your blood pressure brought down into a normal range. If you have hypercholesterolemia, we want you on a medicine and a diet to lower your cholesterol, because each of these different disorders has effects not only on the cardiovascular system, which of course we care about, but most specifically, it can have negative effects on the brain. And we don't want any other um, vulnerabilities, any other disorders to compromise the function and structure of your brain. And next, a slightly simpler topic, though still something that people struggle with, is just preventing injury. So we can't guarantee that you will never sustain a concussion in a car accident. Fluke things happen, tree branches fall off and hit people on the head and give them a concussion. I acknowledge there is risk, and some things are may happen in your life that would damage your brain from a traumatic structural way. But to the extent that we have control over preventing that, like wearing helmets and seatbelts and making good choices about risky behavior, I would encourage you to do so. These are things that you can actively embrace as a means to protect your brain, and they are not trivial. Now, I'm going to transition a little bit to talking about fortifying your castle. So we've just spoken about some concrete things that you can do to stop the attack on your castle. Now we're going to fortify. First of all, treating depression. Depression is unfortunately so common in multiple sclerosis. The lifetime prevalence of depression among MS patients approaches 50%. At any given year, about 20% of MS patients are suffering from depression. And this is not just because it is a hard disease. It is because the multiple sclerosis actually changes the way your brain functions in a way that makes it easier. It lowers the threshold for depression. And yet we know that it is so important to treat. I'll talk a little bit more about that in a minute. I'm going to talk about the importance of eating a healthy diet. We can talk about what healthy means, because there are different interpretations. And then, of course, exercise. So I've jumped a little bit into talking about depression already. It is very common. It is very biochemical, and it contributes to all sorts of other things that can impair your function in multiple sclerosis. Fatigue is worse if you are battling depression. Cognitive impairment, a feeling of social isolation is worse. And when you're depressed, you tend to exercise less, maybe not eat as well, and maybe make different choices about adhering to treatments that you would otherwise take for your multiple sclerosis. So for all of these reasons, and for overall quality of life, it's very important to treat depression. And the good news is that it is responsive to treatment, both pharmacologically and through mental health counseling. So it is treatable, and the impact that this can have on your health is significant. Now to talk on diet. Diet is a important topic in multiple sclerosis, and I bet I am asked by each of my patients at least once, what diet should I be on? What is the best way to treat my body from a nutritional standpoint in a way that will help to mitigate the effects of MS? And it's not an easy question to answer. I'm going to take you through some of what we know, and then we'll talk about what that means when the rubber meets the road. So first, just to add context, Dr. Swank started studying MS and diet in 1950. He enrolled patients, he put them on a diet of low saturated fat, followed them over years. And initially, the study was just a couple years. They able to draw that out to 34 years last time I looked. And they found that the patients that were on the lowest saturated fat um, uh, category actually did better. They had 3 times the lower mortality rate than others. So that would seem to indicate there's something there. We know also that a high-fat diet is associated with relapses in the pediatric MS population. And we know, again, using the EAE model of MS in mice, we know that those mice who were fed a high-fat diet had more brain inflammation and more disease burden than the mice who had a lower saturated fat diet. So there is an argument to be made for paying attention to fat, and not just all fat, but saturated fat in particular. Said a different way, looked at it from a positive spin, we know that a healthy diet is associated with lower patient-reported disability and depression. And that was in a study with 7,000 enrollees, which is a good number on which to base some conclusions. We also know that hydration matters. I think this is something that none of us pay enough attention to, but there are studies correlating the amount of water we take in on a daily basis with less fatigue. And I think if you are a patient with MS listening to this, you will have the experience of MS fatigue, which is and can be significant. Other studies have correlated a paleo diet, so a diet very rich in vegetables and some meat with few carbs, with improved fatigue as well. Now, there's more to talk about, but I'm going to come back to what that all means for us. I'm going to share a few other things. Other areas of inquiry with respect to diet in MS have looked at caloric restriction. What that means is, rather than eating, the number of calories that you would like to in a day, let's say it's 2,000, caloric restriction would be something less than that, 10%, 20% less than that. And it has been associated with anti-inflammatory and neuroprotective effects. It's good for your brain. And that has been correlated with an improved quality of life and lower depression scores when they've been measured. So that's important to keep in mind. And, conversely as well, cholesterol, I've mentioned treating cholesterol is an important part of health in general. This has been studied in MS and found that there are a higher number of T2 lesions. Those are spots, as I refer to with my patients, on your brain if your cholesterol is high. Now, a bit of good news is that if you are a coffee drinker, good for you. There are some positive effects of coffee, decreasing all-cause mortality. It is actually included in guidelines, US dietary guidelines, and it has some anti-inflammatory properties. So how do we put this all together? Does that mean that we should all drink coffee and be on a paleo, plant-based, gluten-free diet with restricted calories and intermittent fasting? No. If you can do all of that, more power to you. But that is not what I am suggesting necessarily. I'm just putting forward some of the evidence that we have. One of the more feasible goals, which has been well studied and well described, is something called the Mediterranean diet. And these are guidelines that the diet espouses: cooking with olive oil over butter, eating grains that are unrefined, plentiful vegetables and fruit, some dairy, a lot of fish, and then less red meat and gluten. It's not strictly excluded from this diet, but it is de-emphasized, with rather the emphasis being more on fish, vegetables, whole grains. And it is, I would argue, maybe more sustainable than a plant-based paleo, gluten and dairy-free diet. Here's some concepts. What we can take from the data that has been done, has been accrued through studies, is that we all need more vegetables. The motto, strive for 5, should be in our brains always. If we can get 5 servings of fruits and vegetables a day, and more vegetables than fruit, we're doing pretty well. The more fish, the better. For the fatty acids, the DHA and the EPA that help our bodies to function, our brains to function better. And we should all be drinking a lot of water, probably more than we are already. What we need less of to function at a highest level, again, we're talking about fortifying our brain, is less saturated animal fat, less trans fatty acids, fewer sweetened drinks, a whole lot less salt, actually, and I didn't even get into the evidence on that, and then less whole cow's milk. If we can minimize these things while maximizing vegetables, fish, and hydration, I think we'll be doing well, whatever you call your diet. And the scope of this talk is a little bit narrow to fully give attention to the gut microbiome, but I do want to introduce this concept that within our gut, we have 10 times the number of cells than we actually have in our body. And that is our microbial population, our microbial, you know, family of bacteria living in our gut, and they matter. The biodiversity of the flora in our gut matters because most of our immune system is direct facing with the gut. And so what we have in our gut is influencing our immune system in general. And what we want is something called eubiosis, which we see represented in flowers on the left. We have a biodiversity. We have lots of colors. We have different shapes of leaves. Everything is pretty well balanced. There's not one thing dominating over another. Whereas dysbiosis is what we don't want in our gut. This is an overgrown garden. There is not as much biodiversity. We don't, in fact, see any flowers. It is imbalanced. This is a pictorial representation of what we don't want going in our gut and going on in our gut, and what we eat matters. No amount of a probiotic supplement is going to bring us into eubiosis if we do not also have a balanced diet to go with that. And so again, the implications of eating a healthy diet are significant when it comes to our immune system. Now, another meaty topic in the category of fortifying our defenses is exercise. And exercise honestly could have gone in the category of defending as well, but we're going to talk about it here. And I hear oftentimes from my patients, well, I have a pretty active lifestyle. You know, I have a 3-year-old, I'm a waitress, I'm a school teacher, I'm on my feet always. You know, this is great. A sedentary lifestyle is something we want to strive against, but it's not exercise. None of those things are exercise. So I put in a definition to remind us that exercise is planned, structured, it's a defined period of time, and the goal of which is to improve or maintain our physical fitness. So this is different. This is more than just an active lifestyle. This is actually making a commitment to your physical fitness, and should be scheduled, or at least should occur regularly if not scheduled. The benefits are true for everyone, whether they have MS or not, but particularly in patients who are living with MS, we want all of the benefits that exercise can give. Improved cognition, quality of life, longevity, mental health, improved sleep, which can be a big issue, anxiety, less anxiety. These are all the benefits that exercise can give us. So we know that there is value in this. We also know that it's hard, but to the extent that everyone can exercise 3 to 5 times a week, for 20 to 30 minutes minimum at a time, the better off you will be. And sometimes it does require scheduling things on a calendar or having an exercise buddy, but the dedication will pay off in spades if you can incorporate that as your strategy for fortifying your brain health. So here's some concepts. Keep your body healthy to keep your brain healthy. In general, things that are good for your body are going to be good for your brain. So we're going to stop smoking, stop excessive drinking, prevent injury, treat other health conditions, particularly cardiovascular health conditions like hyperlipidemia, high blood pressure, diabetes. We're going to fuel your brain with healthy foods and hydration and exercise for your benefit of your brain and your body. So to end, here are my top 10 list of hopefully concrete things for you to take home from this presentation today, or take with you if you're already home. Number 1, talk with your MS doctor about disease-modifying therapy if you are not on a therapy or a therapy that is working for you. This is important in preventing the attack on your brain. Limit alcohol. Quit smoking. I know it's so easy to say, but it is so important to do. Number 4, treat hypertension, high cholesterol, diabetes, and depression. As we talked about, depression has so many different effects on your health and so many um, uh, implications on if it is not treated appropriately. Prevent injury through things like wearing a bike helmet and, managing your risk. Eat less of saturated fats, processed foods, salt, and more of vegetables, whole foods, fish, and water. Be hydrated. Be very well hydrated. Number 8, exercise. And for everybody, this is going to look a little different. That's why I'm not giving a prescription for yoga to everyone. If you have a weak leg, then your exercise regimen is going to look different than somebody else who might have compromised vision. So this is really something that needs to be customized for you, but will ideally include stretching, strengthening, and that does not have to involve weightlifting, but strengthening of your muscles and aerobic activity as you're able. Maintain a healthy weight. This is a theme that flows throughout much of which I have discussed, but I want to bring special attention to that a higher BMI, it is correlated with many other things that jeopardize your brain's health. It is pro-inflammatory. It's probably meaning you're not getting enough exercise, maybe not enough of the right foods, and we want to maintain a healthy weight. And lastly, consult with a nutritionist, a physical therapist about a plan that is customized for you. These are some tenets to take with you, to process, to think about how they're going to work in your life, but someone skilled in the intricacies of nutrition and physical exercise can really help put together a plan that is customized for you so that you will succeed and ultimately do your best to defend and fortify your castle. I'd like to thank you for your attention.